Welcome. You've joined us for another deep dive. Today we're getting into something pretty interesting, maybe a bit mysterious even, in vet medicine. Veterinary Hypereosinophilic Syndrome, HES for
Mhm.
short. We've got some excerpts here from a specialized text you shared. We're going to, try and unpack it.
Yeah, that's the plan. And HES, basically, it's about having persistently high levels of eosinophils, those white blood cells.
Right, the ones for parasites and allergies, usually.
Exactly. But here they're just way too high, and we don't know why. They start infiltrating organs, causing, well, quite a bit of damage, unfortunately. And we don't know why, the idiopathic nature, that's what makes it so tricky.
Okay, so our mission today for you listening is to really break down the essentials of HES, what it
Yeah.
is, what it does, how vets figure it out and manage it.
Yeah, without getting bogged down too much.
Right, because it can be serious. And the fact that we don't fully understand its origins,
Yeah.
well, that raises some questions.
Yeah.
Okay, let's dive in. The basics of HES.
Okay, so fundamentally, you've got this ongoing, um, unexplained high eosinophil count in the blood. And then these cells, they move into various organs, multiple organs usually, and cause problems, dysfunction.
And it's not trivial, right? The text mentions it can be fatal.
Oh, absolutely. If it's left untreated, the prognosis isn't good. The current thinking, the hypothesis kind of goes in two main directions. Maybe it's a massive overreaction to some antigen we just haven't identified yet.
Like the immune system going haywire over a mystery trigger.
Exactly. Or maybe the problem lies in how the body controls eosinophil production itself. The regulation just goes wrong somewhere.
So these cells that are normally defenders sort of turn on the body. Friendly fire,
That's a
basically.
good way to put it. And the damage.
See that it would?
It's not just crowding. These eosinophils, they have granules inside packed with toxic stuff, and they release cytokines, signaling molecules.
Oh.
So when they pile up in tissues, they just dump these chemicals right there,
Yeah.
direct damage. And not knowing the root cause, well, that makes it tough. You end up managing symptoms, mostly.
Right. So where do these eosinophils typically cause trouble? Which organs are the usual suspects?
The GI tract is very common. Intestines, liver, we see it a lot there. The spleen, too, and bone marrow, naturally, since that's where they're made.
Makes sense.
And the lungs can be involved, seems to be more often in dogs. Also, the lymph nodes nearby, the mesenteric ones in the abdomen, other places too, but those are the big ones.
Sounds like it can really spread out. Is HES like an equal opportunity problem? Cats, dogs?
Well, interestingly, the source suggests it's actually diagnosed more often in cats than in dogs.
No.
Yeah. And there's even a little hint maybe of a breed thing in dogs. Rottweilers are mentioned specifically, possibly more susceptible.
Okay, now this is where it gets really interesting for me. The text brings up this question. Is HES actually different from eosinophilic leukemia? That sounds like a huge distinction.
It is, yeah. It's a really important question. Eosinophilic leukemia, that's a cancer, right? Uncontrolled production of eosinophils. And sometimes, yeah, the line can seem a bit blurry.
How do they tell them apart then?
Well, with leukemia, you typically see way more immature eosinophils in the blood. Like a higher percentage of the total white cells are these baby eosinophils.
Okay.
Anemia, low red blood cells, that tends to be more common and more severe in leukemia, too. And if you look at the bone marrow, the ratio of myeloid cells, the ones making white cells, to erythroid cells, the red cell makers,
Yeah.
it's usually much higher in leukemia, like over 10 to 1.
Wow.
And you see more immature cells, the development looks kind of disorganized. In HES, the bone marrow is busy, sure, but the maturation looks more orderly.
And the tissues, the infiltration.
In leukemia, the infiltrates are often these immature cells too.
Mm.
And in the liver, sometimes they line up along the blood vessels, the sinusoids, maybe without the fibrosis, the scarring you often see in HES.
So it's about cell maturity and how they behave in the tissues.
Got it. And the text did say the outlook, the prognosis for HES is generally poor, especially cats.
Yes, unfortunately, that's what it indicates. It can be a very tough condition. So shifting gears slightly, thinking about who gets it, the signalment, as we call it. Right. The source mentioned, for cats, maybe middle-aged females, domestic short hairs.
Yeah, that seems to be a potential trend they've observed. But, it's important to remember HES can really hit any cat, any age, breed, sex.
Yeah.
And for dogs, like we said, it's rare overall, but that possible Rottweiler connection is definitely something vets and owners should keep in the back of their minds.
Okay, so we have a fuzzy picture of who might be more at risk. What about the signs? What would you, the owner, actually see if your pet was developing HES?
Well, The symptoms can be pretty vague, especially at first. Lethargy is a big one, just low energy, not themselves, and not wanting to eat or eating very little anorexia. Vomiting and diarrhea that kind of comes and goes, that's pretty common too, which fits with the gut involvement we talked about.
And if a vet examines them, what might they find?
Yeah, on exam, an enlarged liver and spleen hepatosplenomegaly, that's a key finding.
Yeah.
Weight loss is common, sometimes severe, leading to emaciation. And feeling the belly, the intestines might feel thickened. Could be all along, could be just sections. Usually not painful, though, interestingly. Lymph nodes might be enlarged, too, the ones inside the abdomen, the mesenteric ones, maybe even some you can feel on the outside, the peripheral ones. Sometimes these eosinophils can actually pile up and form, like, mass lesions in the nodes or organs.
Wow, actual masses.
Yeah, and then less often you might see things like a fever, maybe itchy skin pruritus, or even seizures in some cases. So you can see the challenge, right? Piecing together these varied signs when the root cause is unknown.
Absolutely. It's a wide range. Which brings us back to that cause mystery. We know it's idiopathic, but anything more on why it might happen?
Well, the text mostly circles back to that main idea.
Yeah.
A major reaction to some unknown antigen, something setting off this huge eosinophil response.
Right.
There's also a specific theory mentioned, especially for cats, that maybe eosinophilic enteritis is just inflammation in the gut with lots of eosinophils. Maybe that's an early form. Or perhaps a precursor to full HES.
Interesting, like it starts more localized and then becomes systemic.
Potentially, yeah. It suggests maybe some underlying allergy or hypersensitivity is involved, even if we can't nail down the exact trigger.
And you mentioned comparing it to human medicine. Something about a gene.
Ah, yes. That's a fascinating bit of research, though it hasn't quite panned out the same way in pets yet. In some human HES cases, they found this specific fusion gene, FIP1L1-PDGFRA.
Okay.
And this gene basically ramps up a protein that makes eosinophils grow. So researchers look for something similar in cats and dogs with HES.
Okay.
So far, nothing equivalent has been identified, which kind of suggests the underlying mechanism, what's driving the eosinophil production, might actually be different in animals.
Huh. So that piece of the puzzle is still missing for veterinary HES.
Exactly. We're still trying to figure out the specific pathways involved in pets.
Okay, so if the cause is elusive and the signs are varied, how do vets actually figure this out? How do they diagnose HES?
Yeah, diagnosis is really a combination of things. It's partly ruling out other stuff and partly recognizing the patterns of HES. The first big step is differentials, thinking about all the other conditions that could look like this or cause high eosinophils.
And there are quite a few of those, aren't there?
Yeah, definitely. You've got to rule out what we call reactive eosinophilia. That's where the eosinophils are high because they're reacting to something else.
Like parasites.
Parasites, absolutely. Allergies, hypersensitivities, bacterial or viral infections, fungal infections, even some immune-mediated diseases or cancers.
So how's that different from HES?
Usually in those reactive cases, the eosinophil count isn't as dramatically high as in HES, and the problem tends to be more localized, related to where the infection or allergy is, rather than the widespread organ infiltration you see with HES.
Okay. And then there's differentiating it from the eosinophilic leukemia we discussed.
Right. Critical distinction, we touched on it, but just to recap, leukemia usually means way more immature eosinophils in the blood, a bigger chunk of the white cell count.
More severe anemia, too, you said.
Generally, yes. And that bone marrow picture, the very high ME ratio, over 10-to-1, the disorganized maturation, that points more towards leukemia.
And the tissue infiltrates being immature cells.
Exactly. And that potential sinusoidal pattern in the liver without much fibrosis. Also, those rare chloroma-like masses in cat kidneys, that's more a leukemia thing.
Okay, that clarifies the leukemia distinction nicely.
Yeah.
What about just standard blood tests? CBC, chemistry, urinalysis, what do they show in HES?
Well, the absolute hallmark on the CBC, the complete blood count, is leukocytosis, so high total white blood cells, but specifically mark eosinophilia, really high eosinophil number.
How high are we talking?
The source gives a huge range, actually, from 5,000 mature eosinophils per microliter up to over 130,000, which is massive.
Wow.
You might see what's called a left shift in eosinophils, meaning some immature ones are spilling out into the blood, but that's not always reported. Maybe some basophils are high to esophilia and possibly mild anemia.
And the chemistry and urine tests?
Those can show various abnormalities, but they usually just reflect damage to whichever organs are being affected by the eosinophil infiltration. Liver enzyme changes, kidney value changes, depending on what's involved.
beyond the routine stuff. Any other lab tests?
Yeah, definitely tests to rule out those reactive causes we mentioned. So fecal checks for parasites, heartworm testing, tests for fungal infections, maybe looking under the microscope or doing cultures. Biopsies can also help rule out other things, not just confirm HES.
Makes sense. And imaging,
Yeah.
X-rays, ultrasound, what do they add?
Imaging is really helpful to see which organs are involved and how badly. Contrast X-rays, where they swallow dye, or ultrasound can show if the gut lining looks weird or if the intestinal walls are thickened.
Okay.
And regular X-rays or ultrasound can spot if organs like the liver, spleen, or lymph nodes are enlarged or look infiltrated.
So putting it all together,
Yeah.
what are the really essential procedures to nail down an HES diagnosis?
According to the source, the absolute must-haves are bone marrow evaluation, either an aspirate or a core biopsy, or both, and then biopsies of the affected organs or any masses you find.
Got to get those tissue samples.
Yep. Those are key for the pathologist to look at the cells directly.
And what do pathologists see under the microscope that screams HES?
Well, in the spleen, they'll see lots of eosinophils, usually in the red pulp area, sometimes the white pulp too. In the gut, small intestine mostly, but sometimes colon or stomach eosinophils packed into the lining, the mucosa and submucosa.
And the bone marrow.
The bone marrow is typically hypercellular, just packed with cells, and specifically eosinophilic hyperplasia, way more eosinophils than normal, maybe up to 40% of the cells. But importantly, the eosinophils themselves usually look mature and normal-shaped, and the maturation process seems orderly, even though there are just too many of them. That ME ratio is up, maybe around 7-to-1 on average, but not usually as crazy high as leukemia. Lymph nodes often show reactive changes plus eosinophil infiltration. And less commonly, you might find these infiltrates in skin, heart, liver, lungs, or even eosinophils floating in fluid buildup, like in the chest or abdomen.
Right. That paints a detailed picture at the cell level. So, okay, a pet gets this tough diagnosis. What can actually be done? What's the treatment approach?
Yeah, treatment. The source stresses it's really about long-term management. You're trying to control those high eosinophil numbers and stop or at least slow down the organ damage.
Makes sense.
And of course, managing any specific organ problems that have already developed, like if the liver's affected, you support liver function.
Is there anything that suggests treatment might work better for some?
Interestingly, yes. The text mentions that if a patient has high levels of IgE, that antibody linked to allergies, and those levels drop when they start prednisone treatment, that's actually seen as a good sign. It might correlate with a better response and prognosis.
That is interesting. So what meds are in the toolbox for HES?
The first line, the mainstay, is usually corticosteroids. Prednisone is the common one.
Steroids, okay.
Yep. Usually start with a fairly high dose, like 1 to 3 milligrams per kilogram per day. If that works, suppresses the eosinophils, then you try to carefully taper the dose down maybe to every other day.
Gotcha.
But if the eosinophils creep back up when you taper, you often have to go back to daily dosing, maybe even increase it again. It's a balancing act.
Right. What if steroids aren't enough or the side effects are too much?
Good question. There are other options, though the data might be less robust for some in pets. Imatinib mesylate, that's a drug used in human HES and certain leukemias. It has been tried in cats. The text gives a specific dose, but it notes it's not really standard veterinary practice yet.
Okay.
Chemotherapy drugs are sometimes considered if the pet is steroid resistant, but the source material says there just isn't enough info from vet cases to give solid recommendations on which ones or how to use them best. Hydroxyurea is another one. It can be used to help knock down the eosinophil count if steroids alone aren't cutting it after a week or two. And it might be used longer term alongside steroids if it helps.
Any others?
Let's see. Cyclosporine A is mentioned. That's an immunosuppressant that targets T cells involved in making eosinophils. And then drugs like vincristine or chlorambucil, which are used in human HES, might be options in really tough veterinary cases.
Lots of possibilities, but sounds like some are less common.
Definitely. And a really crucial point with almost all of these, especially the chemo-type drugs and hydroxyurea, you absolutely have to watch out for bone marrow suppression.
Lowering other blood cells.
Exactly. If white counts or platelets drop too low, you have to reduce the dose or stop the drug. It's a major potential side effect.
Right. So that leads into precautions or interactions. Anything specific besides the bone marrow suppression?
Well, the main thing is being aware of the specific potential toxicities for each drug. Bone marrow suppression, or myelosuppression, is the big shared one for several. The text does flag that one potential concern with imatinib, that huming drug is a possible link to kidney disease, specifically protein-losing nephropathy. But it says the link isn't definite yet. Needs more looking into.
Okay, so treatment started. How do you keep tabs on things? What's the follow-up plan?
Follow-up is super important. Regular blood work, definitely monitoring that eosinophil count. Although the text does caution that the blood count doesn't always perfectly mirror what's happening in the organs themselves.
Good point.
And if you're using any of those potentially myelosuppressive drugs, you absolutely need to monitor the total white blood cell count and platelets very closely.
Makes sense. What else?
Owners need to watch closely for any return of those initial signs. The lethargy, not eating, vomiting, diarrhea. Are they getting better, staying stable, getting worse? And depending on which organs were hit, you might do specific function tests periodically, like bile acids for the liver, for example.
Right, continuous monitoring. So, okay, let's try and wrap this up. We've taken a deep dive into veterinary hypereosinophilic syndrome. It's clearly complex, idiopathic, which is key. Too many eosinophils causing multi-organ damage.
And we talked about how vets try to figure it out, ruling out parasites, allergies, leukemia, using blood tests, imaging, and those crucial biopsies.
And the treatment really focused on long-term management, controlling the eosinophils, often starting with steroids, but with other options if needed, always watching for side effects like bone marrow issues.
Exactly. And that idiopathic nature, it just keeps coming back, doesn't it? It really underscores how much more research is needed to understand what actually kicks off this whole process in these animals.
Absolutely. So for you listening, hopefully this deep dive gave you that solid but, manageable understanding of HES you were after.
Yeah.
It makes you think, though, given those hints of similarities but also differences between human and veterinary HES, what might future research uncover? Could understanding one help the other, maybe unlock something about basic immune regulation?
Yeah, or thinking about the wide range of organs it hits.
Yeah.
Are there really subtle early signs we're missing? Signs that could point towards ATS much sooner, potentially leading to earlier intervention for these pets. Lots to still figure out.
Definitely food for thought. Well, thank you for joining us for this deep dive today.